cancer diagnosis is devastating news for anyone. You know, no one is immune from cancer, whether you're poor, rich, young or old. Cancer does not discriminate. And back in the days, there used to be this misconception that cancer was a disease of the elderly, that, oh, when I get to my 60s and 70s, we'll have cancer. No, it's not. Now we're seeing that there's been more awareness of cancer, and there's also have been a rise in cancer with younger people as well, you know, especially skin cancers. If you go to places like Australia, where people like to be in the sun for long periods, there's been a rise in skin cancers. You know, with pollution, you know, the environment, there's been a rise in lung cancers with what we inhale into our lungs. You know, with an increase in the Western diet, even people in, you know, countries that were usually eating Mediterranean diets now adopting the Western diet, countries like Japan, for instance, there has been a rise in stomach and prostate cancers. So cancers have been on the rise. Also bear in mind that we eat a lot of processed foods, a lot of meats, you know, a lot of foods that have been, even before they get to being refined, they've been sprayed with pesticides and fertilizers and all these chemicals we don't know about. These are all factors that have increased the rise of cancer. Now, I've done lots of videos on cancers. You know, if you check my playlist, I've got videos on stomach cancer, I've got videos on prostate cancer, I've got videos on testicular cancer, I've got videos on lung cancer, I've got videos on skin cancer, I've got videos on breast cancer, I've got videos on all the major types of cancers that you can think about, because I want to spread awareness, you know, about the symptoms of cancer. I've done ovarian cancer as well. So there are hidden symptoms. There are symptoms that are not so obvious. You know, symptoms like acid reflux could be a sign of stomach cancer, for example. Symptoms like passing urine too frequently or passing urine more than you'd expect at nighttime could be symptoms of prostate cancer. A lump in your testicle could be a sign of testicular cancer. Breast pain without even feeling a lump in your breast could be an early sign of breast cancer. So these are signs and symptoms that you just need to be vigilant and aware about. It's important to check your body. It is important to do body checks, you know, and any changes in your body that you are unfamiliar with or have not been there previously, do not leave it for too long. Go and see a doctor, because it is important that you get checked out. The earlier you get checked out, the earlier you get the treatment that you need, or the earlier you get reassured that this is not something sinister. So prayers and well wishes. But to anyone out there, you know, who's just got the news that they've got cancer, I wish you well. I wish you a successful treatment. I don't think there's anyone in this planet that does not have a close friend or close relative who has not either had the news that they've got cancer, they've had treatment for cancer, or passed away from cancer. We've all been there. We ourselves need to do our health checks. You know, if you're a man, you know, do your regular prostate checks with your doctor, examine your testicles. If you're a woman, you know, examine your breasts. And both men and women, you know, just be aware of symptoms of bowel cancer, whether it's changing your stools, you know, tummy pain, you know, bloating, any sign or symptoms that's persistent, that doesn't seem to go away, is what we call as a red flag. And I hope you enjoyed this video. Please feel free to share this video to anyone who needs to listen to it.